Good evening, Council. My name is Leah Cohen, and I'm here tonight speaking on behalf of Florida for All. I am the regional organizer for Duval County. There has been great work that has been done recently to expand and improve access to health care for community members. However, we still have a substantial gap in coverage. And there's an opportunity to do that. I'm speaking today on Resolution 0776. You have an opportunity to address that gap for more than 112,000 Duval community members who do not have insurance currently, and many more who are underinsured. By passing this resolution to encourage state legislators to indeed address this gap in Medicaid coverage. Duval in particular will benefit from the closing of that gap. This county ranks in the bottom third for health outcomes, and doing this statewide would address that issue. 76% of uninsured individuals in Duval have used the emergency room for care because that is their only choice. 46% of those individuals do so for minor illnesses. Going in, on average, for a minor illness costs between $1,500 and $3,300. Imagine, and the individuals who are using the emergency room for minor illnesses cannot afford that. In fact, last year, the city of Jacksonville paid $40 million to UF Health Jacksonville for uncovered care. Not addressing the gap in coverage is costing the city and the taxpayers money. It is affecting all of us, but it is particularly devastating for the families who live in this gap. I encourage you to pass this resolution. Thank you.
Thank you so much. Thank you so much for the work that you do, and we appreciate it. And we've been inundated your emails with information on the resolution 776 that Joy Burgess and my information is on record.
Thank you. Carry on.
I wanted to thank you again for all of your work. I'm not going to give you a lot of statistics because we've been inundating your mailboxes with a lot of information. I want to appeal to you that we're not talking about a political issue here. We're talking about a human rights issue. Healthcare in our community is a human rights. And who knew? We all are concerned about it. And what I discovered in this journey, talking to you, is that we're not only concerned about our individual health, we're concerned about the health of other people in our community. And we think about the people who pay their rent and pay their groceries and take care of basic needs and can't afford health care. That bothers us. So I'm asking you all of you to vote yes in support of this initiative, which sends a strong message to Tallahassee that we in Jacksonville support our citizens, support our needs for health care. So thank you so much for your work, and thank you so much for supporting this important initiative in our community. We appreciate you, and have a wonderful Thanksgiving. Thank you so much.
Hi, I'm Carol Pearson-Stockey. My address is on file. I am a resident of Jacksonville, a retired physician, and a breast cancer survivor. I am here to urge the Council to support 776 Medicaid expansion. I know that if I had not had access to screening, medical care, and follow-up care, I know I would not be standing here right now. I had an aggressive form of breast cancer, and 12 years after treatment, I'm still here. Everybody should have that opportunity. Everybody should have those resources. It's un-American for them not to be in place for the entire country. So please, please support Medicaid expansion. Thanks.
Hi, good evening. My name is Jarvis Ramil, and my address is on file. Thank you for the opportunity to address all of you tonight. I'm here to speak in support of Medicaid expansion. I moved to Jacksonville in 2017 to be a volunteer, and during my time, I helped many people of the city navigate the Medicaid application process. And I'd like to just talk about some fast facts on Medicaid eligibility in Florida. In Florida, a single adult with no income would not be eligible for Medicaid. They must be, first, a parent or a relative caregiver of a dependent minor. Otherwise, they must be a pregnant woman or needing institutional care or elderly and disabled. In plain English, able-bodied adults won't just magically get Medicaid eligibility should any form of Medicaid expansion pass, given Florida's history of excluding this group. Technical requirements for eligibility include Florida residency, U.S. citizenship, lawful immigration status, and if you're an adult, you must have at least been here for 5 years to be eligible. And often DCF denies anyone who cannot furnish proof of a social security number or proof that they've applied for one. In a household of 4, adults must make less than $4,368 a year. That's $364 a month to qualify for Medicaid. If they are working, they might, of course, get coverage for their employer, but it's often very costly. And for that same household of 4 to get subsidies through the marketplace, their income must at least be $31,200 a year. So quite a big gap there. It's clear that Florida's Medicaid program is a beast, and whether an expansion or an overhaul of the system happens, it's clear that Floridians want change. In fact, a bill to expand the children's health insurance program unanimously passed in the Florida legislature and was signed into law by the governor, only to be tied up in court because it would cause a loss of $1 million a month. Meanwhile, the budget surplus was in the billions. That's with a B. During my time as a volunteer, I often heard stories from families making a choice between paying for health insurance or making sure that they pay their bills on time. And that's a story that I've heard countless times. Thank you all.
Good evening, everyone. My name is Michael Mazzano. My address is on record. I'm here speaking in support of Resolution 776. I'm a data scientist and a teacher here in the county. And over the summer, I had the privilege to work with the University of North Florida and their Data Science for Social Good program in partnership with a nonprofit called Florida Health Justice Project. Their mission that they came to the university with was to better understand the Medicaid coverage gap and how that's affecting Floridians in light of the opportunities we have for expansion thanks to the Affordable Care Act. So a lot of the other commentators tonight have brought up good data points for why expansion would be beneficial to the state. There's a lot of health reasons. There's a lot of economic reasons. Some of the findings that we found over the summer point to data points that you might not expect if you kind of just have a cursory understanding of the issue. A lot of the folks who would benefit from expansion are those who are working, sometimes several jobs, but just fall within that income bracket where they make too much money to qualify for Medicaid, but they make too little money to be able to benefit from marketplace subsidies. And so, again, I don't want to rehash a bunch of statistics and data points, but here in Duval County, we have many thousands of people in that situation who don't meet that income threshold. They don't fit into that perfect niche of where they're getting the benefits from one program or the other. So I just wanted to add my voice as a citizen, as a data scientist, to say that this is something that if we follow in the footsteps of the other 40 states who have opted in for expansion, it would have a lot of benefits, not just for the state, but for Duval County and the city of Jacksonville. And you can also reach out to me personally if you'd like any more information on some of the data behind Medicaid expansion, how that's benefited other states like North Carolina and the 39 states that preceded that one, or just anything else about this issue. So thank you for your time.
Hello, my name is Kenneth Davis. My address is on file. Today I will be talking about the Medicaid Expansion Resolution 2024-776. First, I want to start by addressing some of the financial concerns. There have been claims that Medicaid expansion is too expensive, but this ignores the significant economic benefits. According to the Florida Policy Institute, Medicaid expansion would bring in $14.3 billion in federal funding over 5 years, offsetting state costs such as behavioral health services and saving Florida $200 million annually. It would also extend health coverage to 570,000 uninsured residents, including those in the coverage gap who are earning too much to qualify for Medicaid but too little to afford the marketplace insurance. This gap leaves 1 in 5 Floridians without access to affordable care, disproportionately impacting communities of color and worsening health disparities. The previous contract dispute between Florida Blue and Baptist Health serves as an example, as this threatened coverage for over 600,000 residents. Untreated mental health issues often lead to law enforcement encounters, escalating into civil lawsuits and costly jail infrastructure. Expanding Medicaid would alleviate these issues, saving money and lives. Hospitals in Florida currently absorb over $2.5 billion annually in uncompensated care costs, a burden Medicaid expansion would significantly reduce. This would stabilize hospital finances and ensure better access to care for all residents and better economy. As far as overreach goes, passing this resolution is not an overreach. Local resolutions like this do not dictate policy to the state legislator, but provide essential feedback showing that Medicaid expansion aligns with the needs and values of Jacksonville's residents. This council has an opportunity to lead by advocating what is best for our entire city. It is our responsibility, the city and the city council, to represent all of Jacksonville, not just the wealthy areas such as San Marco or Beach Boulevard. Well, today will we vote and will we stand for Moncrief, Kings Road, and Go Fair as well? This resolution provides a chance to do unquestionable good and ensure health equity for everyone.
Hi, my name is Erin Dupersonal, and my address is on file. I appreciate your time and attention this evening as I speak in support of Resolution 776. Access to affordable health care is essential for the people of Jacksonville as it continues to develop as a healthy, vibrant community where citizens can thrive. I'm a proud Jacksonville native, and aside from a few of my 41 years spent in other parts of the country, I'm grateful to have spent my life here in my city. I love it here, and I love the recent progress we've made to improve health outcomes for all of Jacksonville through increasing walkability, improving access to mental health care, and resourcing areas of town that have been systemically marginalized. Professionally, I'm a licensed clinical social worker, and I've spent my career working with individuals who are disproportionately unable to access adequate medical care. I also have family members who are uninsured and underinsured and cannot afford medical care when they need it, let alone well care. This isn't politics, it is truly life or death. I'm going to share some facts that you all are likely aware of because they are essential to understanding the importance of this resolution out of Medicaid expansion in Florida. Florida is one of only 11 states that has not expanded Medicaid access, and according to the U.S. News and World Report in 2023, Florida ranks as the 45th of our nation's 50 states in healthcare affordability and health insurance enrollment. Within our state, Duval County's health outcomes ranks 46th out of 67 counties. Resolution 776 speaks for me. It implores our state to finally take the action they have avoided for so long. It will put pressure on our state legislature to do what needs to be done so we can move toward an equitable system that allows the citizens of this beautiful state to thrive. This is not a state issue. Our county has some of the worst health outcomes in the state. We deserve better, and I ask that today each of you take the steps within your power to support Jacksonville being known as a city where on every side of town we will have the opportunity to meet our potential and live long, healthful lives. Thank you for your time.
Thank you, ma'am.